Now, you're out at the field. You're not likely to see blood. You're not likely to see an injury. It's really likely to be internal. How do you know that it's not a broken neck or something, or a spinal column that's causing all this? And you wouldn't dare move that person. I'm an amateur now. This is what I'm suggesting to you. What do we know?
Well, exactly. That's if you're unfamiliar with what might be going on, or unfamiliar how to make that diagnosis, then you should never move an injured player on the field if they've been knocked unconscious, or if they're complaining of back or neck pain on the field. They should be stabilized there, and then certainly taken to the emergency room by an ambulance if that's the concern. Now, if there isn't the concern of a back injury or a neck injury, or they have the symptoms or the signs that I mentioned earlier, with the vomiting and the loss of eyesight or loss of motion in an arm, or seizures, then if it's more consistent with concussion, they don't necessarily have to go to the emergency room right away, because a scan, an MRI or a CT scan, won't show a concussion. It will show something very bad, such as an injury to the neck, like an injury to the spinal cord, or a broken bone, and it shows a bleeding on the brain, but it won't show that a concussion. So certainly, I tell all of my parents, if there is any concern with your child that you want them checked out right away when this happens, they certainly can take them to the emergency room. That is always an option. But if you feel comfortable, and you're a physician or an athletic trainer who has managed a lot of concussions, and this looks like a concussion, and otherwise the child is doing fine, except for the headache or the nausea or something that's signs of concussion, you don't need to take them to the emergency room right away.
Okay, this is sort of interesting now, because we live in truly a medical community. We're very fortunate. A lot of doctors, a lot of specialists, a lot of facilities. And I understand that Harbin Clinic, for whom you are employed with, I understand that Harbin set up a program some time ago to really try to take care of our young people, our most precious commodity, because they're all out there. Look at all of our recreational fields. They're all over the place. What is this program about? How does it work?
Well, a little over a year ago, some of the doctors at the Harbin Clinic, particularly Dr. David Hale, who's a neurologist in Harbin Neurology, Dr. Brad Bushnell in the Department of Orthopedics, and one of the retired doctors, Dr. Paul Ferguson, all were coincidentally thinking about this, how to help with concussions and these injuries that are occurring, and what the best way to help our athletes. Through some meetings and discussions, they came together and thought of the idea of implementing a concussion testing program, and partnered with the schools, the local schools, both the high schools and the colleges, Berry and Shorter, and we've implemented a program where Harbin Clinic donated a set of tests to every school, so that we could get all of the athletes at those schools who are participating in high risk or collision type sports, get a test done at the beginning before they start their sports, called a baseline test. So we know what their brain function is like, and what their memory is like, how well they can remember words and remember shapes. It's all in this computerized test. And then if any injury occurs, that's a concussion is suspected, you then take another test. And it's all based on a computer, and so you can then take it and compare it to how well they did before. And I think it's been an overwhelming success. We're finishing up about the first year of doing it. We've learned how to communicate well with our athletes, with our athletic trainers, with our coaching staffs. It's allowed some athletes to go back to play quicker than we might have done by the older ways. But it's also allowed us to hang on to those athletes and not allow athletes who are still having trouble from a concussion to make sure that they're completely better before we let them go back to play.
Okay, let's think of the mother who's finally going to let her son get into some rough play out there. She's always been afraid this day was going to come, and it's come. Is she going to be briefed somehow before her son becomes involved in one of the heavier sports. Will a school brief her? Is her to go and learn? What should the mother do?
I think it's a combination of both. I think it is important that the school and the coaches and the athletic trainer do some education, even if it's just some information that they can hand out to the parents about football in general or about this program. One of the things that I'm trying to do, and some of the other doctors at the Harbin Clinic are trying to do, is to educate the population and parents about this program that we have, and to educate people more and more about concussions. Fortunately, or unfortunately, there's been a lot of information in the news about concussions, both in the National Football League, the National Hockey League, and Major League Baseball, and with some unfortunate incidences, but also it's brought much more education and much more information to the public, which I think is a good thing. So I'm not sure exactly how much education goes on at Double right now, but certainly it is up to the parent to learn as much as they can about that sport and about some of the programs that are going on. And if anybody has questions, to contact the athletic trainer at the school, the coaches or the administration or the athletic department, or even the Harbin Clinic, they could learn more about what's going on at their high schools.
Can we assume in most of the city-county schools that we are aware of here that there is a certified trainer available? I mean, is any school here deeply into sport that wouldn't have a trainer?
Not to my knowledge. We have an excellent program that have partnered with Floyd Medical Center and Advanced Rehabilitation and Physical Therapy, where there are athletic trainers in all of the high schools in Floyd County and Rome City, and many of the schools surrounding that as well. And it's been an important, it is an extremely important way of delivering medical coverage, rehabilitation, and supervision to these athletes.